Hello doctors, good evening. In the previous session, we have already discussed what are Krishnagata Roga and how to remember each and every Krishnagata Roga according to the modern correlation and Sadhya Sadhyata, and what are the treatment principles which we'll advise for that respective Krishnagata Roga. For the detailed learning of the Krishnagata Roga according to Ayurveda along with their mnemonics, refer our Shalakya playlist. I'll provide you the video link in the description. In this session, we are continuing our topic with the modern correlation of those Krishnagata Roga. First of all, Vrana Sukra. It is correlated with corneal ulcer. As we already said, corneal ulcer can be correlated with the Vrana Sukra. If corneal ulcer is asked in the examination, you have to write all those details regarding that corneal ulcer. Regarding the causes, what is corneal ulcer and pathology of this corneal ulcer, and finally the treatment of corneal ulcer. And at last you have to mention the Vrana Sukra. Okay, corneal ulcer can be correlated with the Vrana Sukra. This has to be mentioned in the final list. Okay, if you still have a time, then you can mention about the Vrana Sukra a few points in this corneal ulcer. Okay, it will be nice if you add a few points regarding this Vrana Sukra. But remember in mind, you have to mention the corneal ulcer according to Ayurveda is considered as Vrana Sukra. Okay, now we'll move into our session. What is the definition of corneal ulcer? This is a loss of corneal tissue. Okay, a loss of corneal tissue. It may be associated with inflammation, and ulcerative keratitis also seen, which lead to final corneal ulcer. Okay, here it is a loss of corneal tissue. We will see inflammation and ulcerative keratitis, which finally leads to corneal ulcer. Okay, this will be considered as the definition of the corneal ulcer. And finally, the causes. Next, after the definition, you have to move on to the causes. What are the causes of corneal ulcer? Bacterial infection, any injury to eye, trauma, and finally, contact lens usage. Okay, all these may be considered as the causes of the corneal ulcer. Okay, you may think how contact lens can cause this corneal ulcer. The rubbing of the contact lens after using those contact lens, if you rub your eyes at that time, there may be a rupture in your cornea. This will lead to an ulcer. So it is also a cause. Next, pathology of corneal ulcer. What is the pathology? It is occurred in 3 stages: progressive stage, stage of regression, and stage of cicatrization. Okay, in the causes we have said it may be caused due to bacteria. Now, what are the bacteria which cause this corneal ulcer? Diphtheria, bacillus, and gonococci bacteria. Okay, now in the progressive stage, what we will see, disease will occur and increase in this progressive stage. Stage of regression, this is the second stage. Here, infiltrations will start to disappear. What we will see in the first stage, it will start to disappear in the stage 2. Stage of cicatrization, this is the third stage. Here, healing of the defect. Okay, we are saying an ulcer will occur. No, that healing will be seen in the third stage. These were the stages of this corneal ulcer, which you have to definitely mention in the corneal ulcer answer. Okay, next, finally, the treatment. What are the treatment principles? Broad spectrum antibiotics, ointments which has to be applied at night before bed, and using a dark glasses, and treatment which affects the peripheral infective conditions. Okay, broad spectrum antibiotics must be used, ointments must be applied at night, and using of dark glasses must be the treatment procedures which will undergo in the corneal ulcer. Okay, here is it clear? We have said what is the definition, what are the causes, and what are the pathological stages, and finally the treatment principle. After this, you have to mention it as a Vrana Sukra. This completes a full-fledged answer of this corneal ulcer. Next, we'll move on to Vrana Sukra. As we already said, Vrana Sukra can be correlated with the corneal opacity. Some consider it as corneal ulcer. Okay, but in most of the cases, it may be correlated with the corneal opacities. What you have to write if it is asked as a corneal opacities means, here what are the causes? When there is a high myopia, okay, we all know myopia is a refractive error of the eye. In such cases, contact lens if placed, okay, at that time, it may cause rupture to the cornea and aberrations may seen which lead to degeneration of the epithelium, which finally leads to the ulcer, okay. The ulcerative condition, if it is not treated, it will move on to the stage of corneal opacity, okay. If the corneal ulcer is not treated in a proper way, it leads to corneal opacity. What are the opacities of cornea? According to density, there will be 3 stages: nebula, macula and glaucoma. Nebula, here we will see a slight discoloration. In the stage of macula, brown opacity will be seen. In the stage of glaucoma, white opacity will be seen. Okay, what are the causes? Heal the corneal ulcer and not treating the corneal ulcer, and any penetrating injuries to the cornea, and in any operative procedures, if a damage occurs to the cornea, it also leads to corneal opacities. Okay, if any foreign body aberration also leads to the corneal opacity. Next, what are the symptoms? If any opacity is seen in a pupil area, it consists of a disturbance in the visual effects. Okay, visual effects will be affected if there is any opacity in a pupillary area. If central opacity is seen, then obstruction of the vision is seen. If there is central opacity, okay, if it means if there is any disturbances and corneal opacity is seen in a very peripheral areas, not distance, not in the corneal area, and it is peripheral, means too large away from the cornea, at that time it doesn't obstruct any vision. Okay, next, these were the 3 stages along with their symptoms. And the risk factors will be vitamin A deficiency, any eye injury, and untreated corneal ulcer, wearing of contact lens overnight. All these were considered as the risk factors of this corneal opacity. Next, what are the treatment principles? According to Ayurveda, it is asadhya roga. It is a sadhya roga. It is a Vrana Sukra. There will be no ulcer, and it is a sadhya roga. What is the treatment principles? Shodhana, lekhananjana, usage, etc. And according to modern, you have to consider 3 individual treatments. We have set the stages. No, in the stages of nebula, we have to treat it by silver chloride and gold chloride. Okay, nebula seen at periphery. If it is seen at periphery, we have to remove it by silver chloride and gold chloride. And if it is in the stage of glaucoma, at that stage we have to go for keratoplasty. Okay, as it is a glaucoma stage, we have to go for keratoplasty. In the stage of macula stage, you can correlate, you can give a treatment based on the depth and spread. Okay, scraping will be advised in the case of glaucoma. Next, coming to Akshipakatya, we have said the 4th one is Akshipakatya. As it is also considered as a corneal ulcer, you can mention all the symptoms and treatment principles which we have discussed in the Vrana Sukra. Okay, next, coming to Ajakajata. We all said Ajakajata can be correlated with the staphyloma. Staphyloma means, what is staphyloma? You have to know, when a fatty mass which resembles a goat feces. Ajakajata. Actually, you have to mention in Ajakajata, it resembles a goat feces, so that it is named as Ajakajata. In the Viva point of view, it is asked, why the corneal means, why in Krishna Gata Roga Ajakajata, the name is given as Ajakajata. You have to write it resembles the feces of the goat, so that it mentioned as Ajakajata. It is a kapha vyadi, asadhya vyadi. Okay, next, it is correlated with the staphyloma. And if it is asked staphyloma means, you have to mention tearing of the cornea will be seen in this case of staphyloma. Okay, blackish portion will be there in the eye, no, that will tear in the staphyloma. Next, here you have to mention what you have to mention 3 layers of eyeball, as we already discussed it in the anatomical view: outer fibrous coat, middle vascular coat, and the inner nervous coat. Okay, in this thinner fibrous coat will be seen. Okay, the fibrous coat will be there, no? The thinning of this fibrous coat will be observed in this staphyloma. Okay, next. The definition of the staphyloma is, it is an abnormal protrusion of a uveal tissue. Okay, here abnormal protrusion of the uveal tissue through a weak point in an eyeball. So that you have to mention the layers of eyeball in a clean and clear diagram. The layers of eyeball, as I have dealt, you can refer a Shalakya playlist, anatomy, most important thing, anatomy of eyeball. In that you can clearly see how to represent the uveal tissue and all. It is an abnormal protrusion of uveal tissue through a weak point of an eyeball. Next, what are the types of staphyloma? Congenital and myopia. Myopia may also cause this staphyloma. Posterior staphyloma, anterior staphyloma were the types of staphyloma, and the posterior staphyloma is caused by congenital or else due to any myopic cases, and anterior staphyloma will be occurred due to any traumal infections and surgical weakening of the sclera. And the third one is intercalary staphyloma. What is intercalary staphyloma? Here staphyloma that appear after a localized bulge is seen in the limbal area. First of all, localized bulge is seen in the limbal area, and later on the staphyloma will occur. What are the causes of this? Any glaucomatic cases and any injury. Finally, the ciliary staphyloma. What is ciliary staphyloma? Here, a bulge of a sclera in its weak part is seen, and it occurs in an area of 2 to 3 mm. Next, what are the causes of this ciliary staphyloma? Any scleritis or else glaucoma, as we already said this in the definition part itself. Next, what is the diagnostic methods which is done under this staphyloma? Dilated fundal eye examination. What is it? Dilated fungal eye examination. Fundal. Okay. And the next thing is ophthalmoscopy. What are the diagnostic methods? Dilated fundal examination of the eye and ophthalmoscopy. Next, what is the treatment principles? Corrective lens must be used for myopia, and it has to be removed during night times. Application of a banked sclera. Okay. And later on, laser treatment, and you have to heal them with an ointment. Okay, this completes the entire things regarding the staphyloma. You have to write the definition, you have to write anterior staphyloma, posterior staphyloma, intercalary staphyloma and ciliary staphyloma. And you have to write the diagnostic methods and finally the treatment principles which we done in the staphyloma. And you have to mention in the final step, it is correlated with the Ajaka Jata according to Ayurveda, and the name Ajaka Jata is given due to the appearance of the goat feces. Okay, this completes the entire things regarding the Krishna Gata Roga, corneal diseases as per modern and according to Ayurveda. In the next coming sections, we will deal in detail regarding the other topics, and Shalya topics also we will discuss. Okay, subscribe to our channel, like our video, share our video. Thank you. Stay tuned to our channel for more and more concepts in an easy way.